you have your questions ready, so we can start immediately without wasting time. And if you don't have, we can basically start with some of the case which I would like to share, especially a case of, yeah, welcome Dr. Bhumika. I would like to share a case where the patient was suffering from severe vertigo, and that was for a long time. Vertigo from Namaste, Telwak ji, Namaskar, and that was for a very long time. And the patient said that whenever I get up in the morning or whenever I get up, so the vertigo is more. So make sure when you are taking that symptom, either morning or waking, you differentiate between that symptom. No, if you sometimes sleep and you wake up, that could be morning, evening, night also, anytime. So try to differentiate between morning, evening, night, or waking. These are all different type of modalities which you have to take care of. So maybe previously he must have not given this type of modality. So he had a very classical symptom when he wakes up. Whenever he sleeps and wakes up, he starts getting vertigo. And the vertigo, adding few more symptoms, we gave a single dose of to the patient, single dose of lycopodium, which cured the case. Now it's very important in case of vertigo to understand the modality. You know, a lot of patients would come and tell you that they have vertigo they have vertigo whatever they do, but in vertigo, whatever I've seen in my practice, the modality is very important, because as such, the symptoms of vertigo in modern science, we have only one tablet, that is Vertin, and till you take it's better. If you stop it, it's back to square one. So we prescribed the patient lycopodium 200 single dose, and gradually within the course of 2 or 3 months, he was cured. Two or three things of lycopodium you should remember in case of vertigo, which we also got in that patient. This is vertigo when the patient has shaking the head involuntary. So whenever the patient shakes the head involuntary, the vertigo starts. That's a very, very important entry point of lycopodium. And in lycopodium, one symptom is very important, that vertigo after fear, or vertigo before or after diarrhea. Now this is a very important symptom. Normally vertigo after diarrhea you can have, but vertigo before diarrhea, then you should always think about the remedy. First is lycopodium. So adding these two symptoms, we prescribed the patient lycopodium, and within I think between 2 or 3 months, the patient was cured with a single dose of lycopodium. To add a few symptoms of lycopodium more, you must think about lycopodium has vertigo in warm places. Write down in your Mater vertigo, especially when the is in warm places. Though lycopodium is a hot remedy, but still the vertigo is more in warm places. You must remember two remedies. Of course, first is lycopodium, and the second remedy is Nux vomica. Nux vomica is chilly and lycopodium is hot, but still lycopodium is indicated in that also. So these are the symptoms, whatever I have understood about lycopodium, you also understand this in lycopodium, so that you don't miss a case of vertigo. Vertigo, as I always tell, it's a very, you know, it's a disease which has to be taken care of, because it's a very irritating problem, and the patient basically is fed up of the problem. So in those cases of vertigo where you find you are not able to get the answers, make sure the modality you ask the patient is very, very important. Vertigo in the morning, evening, before eating, after eating, before doing some work, stress. Lot of symptoms of vertigo are there. If you search the Mater Medica or the repertory, and you will get a lot of good symptoms of vertigo. Yeah, welcome. Okay, there are a lot of doctors: Megha, Dr. Navjot, Dr. Ruchi, Dr. Singh, Vas Puranik, Dr. Mazari, lot of doctors. So welcome. Doctor, best video, share experience, Lolium. If you ask me something about Lolium, I would say that I have very, very very, very rare experience of Lolium, because Lolium I have used, I don't know, I think once in my life or once in my lifetime. So if you ask me about Lolium, I would not be a classical example to think about Lolium, but whatever I have things, if Lolium, One symptom I remember that there was a case of cramps in the calf muscles, and I prescribed lolium, and he reacted very well to that remedy. That's all what I have seen in my practice of lolium. As such, that's the only experience I have of giving lolium in my practice. When to use medorinum in cancer patients. Remember one thing, Dr. Chobe, welcome, Dr. Nafi, welcome. Remember one thing in your mind, that whenever you are prescribing a remedy, or sorinum or syphilinum or medorinum, a lot of people ask me what is the importance of no sod, and when to prescribe the no sod, when to give the no sod. If you have read, Mater Medica, simple in Allen's keynote, also in Soranum, the author has told that use this nosode or use Soranum as per the totality, rather than having that in mind that it is a psychotic miasm. So, to open up the case, give psychotic. First of all, make sure that you give in those cases. Now, in cancer cases, I have found most of the cancer cases, when I'm treating cases of cancer of the pelvis, like of the ovaries, of the uterus, of the what you call male organs, prostate, and all. So this is a very very important symptom, and of course, psychotic miasm in the background with impure coition. Impure coition means that the person has been exposed to those type of condition, and that is special relation to uterus or ovaries or the fallopian tube. I have found this, it has a very very interesting role to play. Most of the cases which I have found that they are working very well, and it is not going further, I normally give medorinum as an intercurrent remedy. So if you understand this, you just open Allen's keynote. First line, it is written, for the constitutional effects of maltreated and suppressed gonorrhea, when the best selected remedy fails, or it permanently remove the case. And that's how I have used these cases in my practice. If you see in Allen's keynote only, it is a condition where it is given for chronic, salpingitis, or ovaritis, or pelvic complaints, tumors of ovaries, tumors of uterus, psychotic origin. Now that's the entry, or serous carcinoma, cancers, everything, or any history of cancer, a psychotic history that could be traced in the hereditary. These are the cases where you have to use medorinum as an intercurrent remedy. But a word of caution, that if your case is exactly medorinum, if your case is a constitutional remedy, medorinum is coming out, please don't hesitate to start the treatment using medorinum as any other remedy, a constitutional remedy for a given case. That is what I've experienced in either medorinum or syphilinum or sorinum in my practice. Okay. Okay, Dr. Umesh, welcome. Dr. Abha, Dr. Kardak, welcome. Sir, a few weeks back, I had sent the picture of varicose vein, and you kindly looked into it, sir, and approached towards the case. Good morning from Portugal. Okay. Good morning, Dr. Alexander. Varicose vein. I think if you send the whole case to me, so it will be very easy for me to understand, and then prescribe the remedy. Because varicose vein, as I suppose I told you last time also, no, there are some specific remedy which some doctors specifically give to patients. Like we have very classical remedy like hemamelis, we have carbovage, sickle core, and these remedies are routinely given. Of course, then we have carboanimalis and those remedies also, depending upon the what you call the color of the vein. It is either reddish in color, bluish in color, greenish in color. Those would be a specific prescription. But of course, make sure in case of varicose vein, that is my observation, that the patient has to be told that hanging the legs, if he's in profession of a teacher or a doctor or a surgeon, and is continuously standing and hanging the legs, then what happens, the blood comes down the varicose vein, it does not go up. We don't have a valve system, or you put the motor and the blood goes up, it does not go up. So in those cases, this occupational therapy is also very important. We have to tell the patient that you have to take a stool and put the leg straight, so that it is not always resting. Otherwise, see what happens in most of the cases, the patient comes with varicose vein, and the patient says, whenever my legs are hanging, there's a lot of pain, and that is a normal pain, because whenever the blood comes down and it is already engorged and tortuous, it would pain. And see, then most of the us try to prescribe vipera, because vipera has a very interesting symptom, that hanging the legs aggravates. So this is a normal symptom. So make sure that you differentiate normal symptoms of varicose vein give some occupational treatment and the remedy that will give a very good result in your cases. Of course, tell the patient to wear stockings, so that the veins are immobilized, and that would give a better result. So that's very important. Dr. Sir, one patient for virals, she's suffering from intense sleepiness and stiffness of neck and guidance. What shall I give her? She is having still yellowish discharge from the nose. So whenever you have, whenever Dr. Bhumika, okay, I'll come for your with your question answer, Dr. Riyasa, I'll come. So Dr. Sonam, whenever if your patient comes to you, I've always tell what is the presenting symptom that you have to ask. Now in your case, the patient has classically, what you call, come around with the symptoms of sleepiness. So whenever there is sleepiness, you have to understand, you have to enter through that case. Like for instance, we have antimtat. It's a remedy where the sleepiness is more. Or you can take arsenic also. Sleepiness is very more. Make sure that you enter the case through the sleepiness and then try to repetize and then get the remedy. So think about first remedy antimtat. Think about moscus. Think about arsenic. These are very very interesting and good remedies to start with, rather than seeing at the discharge from the nose is yellowish, because this is more psychosyphilitic than the discharge of the nose. That's important. So entry point is always what is the patient presented with you. So this take this for prescription and you will get good results, Dr. Sonam. It's my, how will I send you the whole case, sir? Of course, you can send me the whole case, Dr. Sangma, because you are the most better judge of yourself, and surprisingly, you are a doctor also, so you could basically relate your case very well, and it's basically between me and you. So you can send me on the WhatsApp, and I will try to find out some remedy, give you few remedies which I find very suitable in your case, and you can then try. Before that, make sure that if you are in your OPD and doing a practice and you have long hours of sitting, put a table in front of you so the legs are straight and the gravity does not pull the blood down. So that make sure you are using that, and plus you're using stockings so that the intensity is taken care of. Fungal infection, of course, a very very, if you tell me also, very very irritable case to treat, because it does not get relief with a lot of the remedies. But see, of course, if you give me the case, I basically have all the cases repertorized, because in fungal infection there are few remedies which are very commonly used. You can write down the name. We have natramur, we have sepia, we have tellurium, we have basilinum. So these remedies are very very good. You can give these remedies. It is try and luck. If you succeed, good. If you don't succeed, then there's a problem. There are few remedies which I have used in my practice. Apart from these remedies which have given me good results is Azadirachta indica, Echinacea, Merxol, and Zincum metallicum. These remedies have given me good results, apart from this so-called used remedies like sepia, natrum, tellurium, and basilinum. So depending on the area, itching is more on the left side, itching is more on the right side, itching is in the abdomen or the whole body, or itching is more in the night, itching is more in the morning. Don't take that symptom. Most of the patient will come and tell you that itching is after undressing. So if you give kali ars, in that case it does not work. And make sure that in the background the patient is not suffering from diabetes, because in a lot of diabetics you can get this type of fungal infection. So do take care of this treatment. One remedy also very very important that you should remember is chrysobium. Remember the remedy chrysobium. It is called acid chryso. It's also a very very good remedy. Do read from the Mater Medica, and that will also suit your case in case of that rare and specific remedies. Okay. Good afternoon. It's not morning, Dr. Borkar. Good afternoon. I hope you got something about the fungus. It was on the Instagram. Yeah, Dr. Bhumika. One question: patient like swollen similar to filariasis, but tests are negative. What would it be? Blisters along with the fever and after 3 years. Make sure if the case is of long standing, then see the swelling. The swelling is big. The swelling is very tight. The swelling is pitting. It is non-pitting. It is more after standing. It is more after sleeping. It is reddish in color, bluish in color, dark in color. So try to define that local part. Every time the case is not that, start asking the mental symptom. Define that local part. Go to the repertory. You have a lot of remedies. Take help of that, and you can get the remedy. Case of schizophrenia, no lady very much afraid of someone is going to steal her kidney, cries and screams. Oh, fantastic. In schizophrenia, when you're taking a case, it's like basically watching a movie. The different patients have different type of varieties of fancies, and try to describe their themes in vivid colors and all. But in your case also, it's a fantastic symptom, that stealing kidney and all. See, every case of schizophrenia or depression, basically what is seen in front of us has a background. It's like an ocean behind, and it's a drop of water in front of us. It's like tears coming from the eyes, but it has an ocean of water behind. So in this case of schizophrenia, if the patient is classical, see, the patient of schizophrenia would tell different symptom different times. One time he will say, if he will say that I feel that the patient will sell my the every will sell my kidney. Next time he will say that I'll get a heart attack and my heart will faint. So if it keeps changing this type of symptom, don't take the symptom for prescription. But if the patient is hell bent on taking the kidney, so make sure what happened behind that. What happened behind, why is there in the problem, was there a problem of kidney infection, kidney failure in family, where the patient has seen a kidney transplant, whether the patient has seen a case of renal failure and he has gone to that trauma. One thing is very important: whatever is there in the mind is always because of some cause. That is very important. Secondly, there are some cases where the patient has lot of things to tell to the world, lot of things to say, lot of painful thoughts, but it is so suppressed in the mind because of the culture, because of the society, because of his type of temperament, that he is not able to come out of that, and that also causes these symptoms of kidney. So there are two things you basically have to treat in this type of cases. PCOS treatments are in duration. Of course, I would tell you that duration we can't tell, because depends upon your selection of remedy. Of course, PCOS, if you tell me also, it is definitely difficult because it's a syndrome, hormones are involved, and in a lot of cases, PCOS comes to us after taking metformin, because they go to the conventional treatment. The treatment is metformin. They try to give metformin twice a day, sometimes thrice a day, and the patient is much better. But symptomatically, the patient is very bad. The menses problem are there, ovary has cyst, hirsutism is there, bloating, obesity is there, hair falling is there. So the patient is basically under hormonal trauma. In these type of cases, of late I have seen very, very good results, where you ask the patient whether the patient has taken some hormonal treatment to prolong the menses or to bring the menses, or any treatment related to menses. That's first. Ask whether the first menses at menarche was delayed or late. See the patient, look at the patient, whether he has male type of pattern, male type of voice. If you have heard my YouTube or Google Meet or Insta Live, I have told in these cases I try to first give the remedy testosterone, and then start up the case. Secondly, look at the remedies like progesterone, look at the remedies like estrogens. They are very good remedies for either to open up the case or to start up the case. Or your indicated remedy is working very well and suddenly it stops working. So these hormonal remedies, estrogen, progesterone, testosterone, and one more remedy you have to add in your matriptylin, that is folliculinum. These have given me very good results when I have found either I have started the case with those remedies to open up the case, or I have found that the remedy has stopped working, which was working beautifully. So I give an intercurrent depending on the case, and that has given me good results. So you also look into the Mater Medica, and you will get good results with these remedies also. Thank you. Good afternoon, Dr. Paul. Now, okay, I hope you understood the case. Next time, go to the repertory and see the, if you have a beautiful rubric in the extremities, if you extremities chapter, and of late, I also have few cases where the swelling is so much, and the patient has no symptoms. So go in that chapter, see, and you'll have a lot of, in fact, when you touch that part also, the temperature of that area also important. It is cold, it is not normal, slightly warm. That also will give you some remedies, that's important. Okay, so yeah, so I think some question on Instagram might have scrolled up. Yeah, so so if you have no questions more, or some questions have been scrolled up, I can tell something to Doctor who is just written something about. No, we don't have any swelling. So see, then you have to see this, how is the swelling. So we have remedies, apis mellica, we have arsenic. There are a lot of remedies, and then depend, in your case it is basically you have written that swelling of the lower limb, and how is the swelling, that is also very important. So swelling, very tortuous, very firm, very hard, cold or heat. Depends on that. You can have remedies like arsenic, epismel, china, lycopodium, sambucus. Like for instance, I had a case where the swelling was very hard. So we prescribe the remedy to the patient, simple remedy, ledampal, and the case reacted very well. For example, you see a case where the swelling is like uh, we have a question test. I'll just tell you, where the swelling was hot, and in that case, Brahanya worked really well. And sometimes that's swelling because of liver complaints. In that, I have given China sulf, which has acted beautifully. So that depending on the case, you basically differentiate the remedies. um, which book? Testosterone. Yeah, see, testosterone is basically latest remedy which have been proved, and if you go to Mater Medica, I don't know which Mater Medica, but because in today's world we have softwares, so you can go to any software, latest software, and read testosterone. I'll just give an example where I have used testosterone. I had a case of a girl, I should say, 20. She was 22 years age. She had a lot of problem of amenorrhea. Menses would never come in, after never come in, only came after taking tablets. When I took the case, I also did not understand testosterone at that time, so I prescribed the medicine. It did not work. But on deeper understanding the case, I found that that girl that had a voice which was very mannish type, that male type of voice and male type of hairs, male pattern of thinking, talking, and behaving. So I had started the remedy test. I gave the remedy testosterone 1 m and waited for the case. And in fact, that after that, I have never repeated any other remedy given before, and that cured the case. So in today's world, psychosyphilitic world, there are a lot of ladies, female doing male type of works, male type of attitude. There's no gender difference now. So these type of cases you will get lots in your practice. So you can use these remedies, and they will give you good results. In Mater Medica, basically books I cannot tell you because software we do use in our practice now. That's why. Okay, Dr. Panch Bhai, welcome. Yeah, can we have other questions, because I hope there are some questions have already gone up, scrolled up. Sorry. So I was telling something about the swelling. These are very very important, because whenever the patient sees the swelling, he is very afraid. Okay, what will happen? Whether I have kidney problem, whether I have heart problem, and he'll continuously pester you. And in allopathy, they give Lasix, and he has a lot of urination, and the swelling goes, but you stop back to square one. So do take the case very properly. A local symptom also would give you good results. So I hope you got something about this, Dr. Baba, and you would definitely help that case if you take that local symptom, because I found local symptom in those cases, work very well. Okay. Good afternoon, Dr. Gurudev. Dr. Elisa Franco, welcome. Yeah. After a long time, I'm seeing you. I hope something you got about testosterone. Do go to that chapter of some what do you call program, and you'll get those remedies very easily. Okay. So, Dr. Baba, I hope you got something about the swelling, and you can have swelling, there are a lot of, the swelling is painful sometimes, painful edema, painful swelling. In that, you can think about Merxol. Then, how is the pain? Burning pain, arsenic, cutting pain, phosphoric acid, and the patient just sometimes, it's something is pulsating inside. Then you have remedies, I think, pulsating pain, I think phosphoric acid is there. So, there are different types of, remedies and different types of local symptom that are very important to understand and ask the patient, because you can see in the swelling how is the local symptom. That would give you good inputs. Good afternoon, Dr. Dubey. SIBO. I didn't understand what is SIBO. If you could answer me, if you can ask question, small intestinal bacterial growth. Yeah, see, whenever you have a small intestinal bacterial overgrowth, I would say in homeopathy, what is what is in our plate of thoughts, the symptoms. I believe if you have some symptoms in front of you, you are able to prescribe properly. Otherwise, we have remedies E. coli also. In our practice in our Mater Medica, And E. coli, if I have an LM potency, and that gives you good result. But symptomatic is very important. What is the symptom? That's important. Then I could answer it better. Welcome, Dr. Rahman. Urethral fibrosis experience. Yeah, see, urethral fibrosis again, symptoms. If I tell you some symptom like difficulty in passing urine, has to strain to pass the urine in strictures and fibrosis, and the patient has to use dilatation, very, very painful condition. If you ask me also, there are cases which I have got very good results, but there are cases also where I have not got results. If you see the patient has been using a lot of dilatation methods unnecessary, so in those cases, metformin is very important. But I found very, very good results with remedies like clematis, rhododendron, sulfur, calcarea floor, of course, Savalsar. These are the remedies which have given me good results. But ask the patient how did the fibrosis start. That is very important. He must be in a habit of suppressing the urine, not going to the urinal, or not what do you call, going outside, not using urine pots, having recurrent UTI, recurrent infection, habit of taking a lot of antibiotics, lot of things have that effect on the on that urethra, and then you can get stricture. So history taking in those cases are very, very important. Cancer patient age 62 have chemo, one symptom of cough, better long. I have prescribed Stanamet 200, improvement is there, no taste of cough. What next? Yeah, if you have, if you feel better with Stannum metallicum, then wait. If you're feeling, the patient is feeling better with Stannum metallicum, then wait for some time. Don't change the remedies. Or if you find that you have to repeat the dose, give Stannum metallicum in LM potency, and that should be fine. That's very important. History taking is very important. If you have history taking is good, and how did the cancer start, that's very important. You ask the family history, the hereditary history, what is there in the history, because which the patient has suffered from cancer. That's important. After operation of fistula, no, okay, you can get stricture after operation of fistula, then you have to understand whether the anesthesia used was too high to cause that secondary symptom of fibrosis or the stricture in the urethra. That's also a good entry point. Then you have to take bad effects of anesthesia and then prescribe the remedy. I'll just first finish off some Instagram questions. They are pending. In a situation, higher level of histamine, cough, yeah. If you have high level of histamine, which if you see the ASR is high, histamine is high, of course, a lot of doctors would tell you give or start the case with histamine. But I would say when you start histamine, if you do if you take histamine in LM proteins and repetition, all the symptoms would be better. All the symptoms are better. But I've seen in a lot of cases when you stop histamine, it's back to square one. This patient is very hypersensitive, very sensitive to external stimuli. Probe the case taking through the sensitiveness, and then it's a very, very easy journey. A single dose repeated maybe once a month. I had a case of a high histamine level. He was on histamine LM potency, much better. But then after taking the case, I found the patient was tuberculum. Then tuberculum 1M I gave to the patient single dose and waited, and told the patient that if you get an acute symptoms of allergies at that time, if you're out, if you cannot contact me, don't take antibiotic, take histamine LM potency which I had given him, and the patient is doing very much fine and he is much better with that. सर फॉर एक पेशेंट हम है, उनको गले की नस सूख गई है, राइट साइड एंटीरियर पार्ट ऑफ नेक, सीवियर नी जॉइंट, स्टैंडिंग इरेक्ट आफ्टर सिटिंग इज वेरी पेनफुल, पेन अपर पेनफुल, टेक सपोर्ट ऑफ बोथ द हैंड्स, नफाइलम विल वर्क. Naphthalene is more indicated remedy for sciatica, and नस, anterior नस basically आपने क्या बोला, नस लग गई है. So in those cases, you can always start with a simple remedy, Rustox, Macfos, Semesifuga, those would give you results. Naphthalene I have never used, but we cannot tell homeopathy it will not work or work, but I have used Naphthalene more cases of sciatica, more nerve problem related to lower extremity. So you can try Rustox, Macfos, Semesifuga. These are the remedies which could give you results. Okay, thank you. Can we help in case of reduced amniotic fluid? See, whenever if you have a case of reduced amniotic fluid, It's a constitutional problem where the constitution is not able to produce the amount of amniotic fluid required to sustain the pregnancy. In this case, just one or two question in relation to pregnancy, and that would solve your case. I have lots of cases in my practice. I have seen they have given me good results. So one or two questions in pregnancy, the change which he felt, which was not there before pregnancy, and that is the entry point of the case. Tick bite more than 2 months ago. Ledum and Borrelia was given at the time, but there is still now like a hard red lump, like a mosquito bite on the local site. Tick bite. Ledempar Borrelia, I have never used in my practice, so I cannot tell you something about Borrelia. But Ledempal should have worked in your case. I don't know why Ledempal did not work, because Ledempal is definitely indicated in these type of cases. Uh, See, in this case, whenever you get a case of bite, a dog bite, in your case, it's a tick bite. If you open the repertory, if you open the mater medica, there is no symptom as tick bite. But if Ledempal has not worked, surprisingly, two or three remedies which I have found useful in my practice. It may also work in your case. It may not cannot work on your case. First is of course Ledempal. Second, do think about Ichnisia angustifolia. Third, think about lachesis, and fourth, think about arsenic album. These are the remedies you can try. But again, if Ledempal has not worked, try LM potency Ledempal. That would work better, I feel, in this case. But in repertory, if you see, we have no remedy for tick bite as such. We have only for bites, and these remedies are useful. Of course, you can think about hypericum also. Okay. Okay, so it's already 3:30 and we are up again. And it was a very interesting session today. A lot of questions asked, so that I could also learn something about my knowledge of mater medica and what I am lacking and what I have to read. But thanks for sharing your questions and experiencing good results in your practice, because a lot of doctors have wrote me on my WhatsApp that the sessions are nice. Thank you so much. And I hope you like this Insta and YouTube live as much as I like sharing my knowledge with you. Thank you. Until we meet again on next Saturday. Thank you so much.